and joining this webinar. So Youth in Dentistry is paired with ScienceHolic, Holistic, and I'm the secretary for Youth in Dentistry. So we're just going to talk about the specialties, and then I'm going to talk later in the presentation about just what it means to be pre-dental. If you guys have any questions, there's going to be a Q&A at the end, so feel free to ask me anything, and I guess we're just going to get started now. So let's see if I can change the screen. I don't know if I can. Okay. That's not right.
Okay, so I'm the founder of Youth in Dentistry. I'm Angela. So now I'm going to introduce our organization. So Youth in Dentistry is a student-led online organization that we want to inspire and encourage students to learn about the dentistry field. So topics we covered on our Instagram page is 9 dental specialties and dental schools around the world and pre-dental students. We also did takeovers with dental students and dentists, and we have we currently have multiple chapters around the world, and it's listed on the slides.
All right, hi everyone. So I'm an ambassador for ScienceHolic. So ScienceHolic is a youth-run nonprofit organization that aims to introduce very specific scientific concepts in a manner that's fun and comprehensible to teens. It's a free resource for students to learn about more science topics. And ScienceHolic also provides various opportunities for students around the world with their English as their second language to help enhance their English ability and provide unique volunteer and leadership opportunities. We also have sub-branches, including seasonal magazines, monthly webinars, and newly established bi-yearly reviews. Also monthly blogs, articles, and fun science facts. And here's the ScienceHolic website link.
So Angela, if you want to introduce yourself.
Okay, so I'm the founder of Youth in Dentistry. I'm a rising high school junior, and I love running, bullet journal, and calligraphy and stuff. Yeah.
Hey, hi everyone. My name is Nee. I'm the vice chair of Youth in Dentistry. I'm also an incoming first year at the University of California, Los Angeles. I'm a biology major on the pre-dental track. I've done dental shadowing, hospital volunteering. I really enjoy music, crochet, stuff like that.
And here I am, guys. So I am a fourth year student at the Ohio State University. I'm going to be entering my final semester at Ohio State. I'm graduating a semester early. So I actually first attended Ohio University my freshman year, and I then transferred schools my sophomore year to Ohio State, where I'm now majoring in nutrition, following a pre-dental curriculum. I just applied to dental school, so I'm pretty much just waiting to hear back for my interviews. My hobbies include blogging. I run my own Instagram blog. That's everything pre-dental. So I'm very active on there, and I'll talk about that at the end as well. And I enjoy cooking and traveling. So if you guys have any questions, send them in the chat, and we'll go through them at the end of the webinar if we have time for a Q&A, which I think that we should.
So Angela will quickly go over the different dental specialties. So first of all, what is dentistry? So according to the American Dental Education Association, dental profession is a branch that healthcare devoted to maintaining the health of the teeth, the gums, and other tissues in and around the mouth. And this can include dental medicine, oral health, public health. Generally, dentists are teeth doctors, so they have gone through about 8 years of education, not including any specialty trainings or residency, which qualifies them for either a Doctor of Dental Medicine degree or a Doctor of Dental Surgery degree. Often dentists can run their own practices. They can also work in group practices. They can work for corporations. They can work for the Federal Defense Department, which is working in the Army. And they can also partake in community service clinics, which provides free dental services, free healthcare for underserved communities.
So there are currently 12 dental specialties recognized by the U.S. National Commissions. There's dental anesthesiology, dental public health, endodontics, oral and maxillofacial pathology, radiology and surgery, and then oral medicine, orofacial pain, and orthodontics and dental facial orthopedics, pediatric dentistry, periodontics, and prosthodontics.
So just to go over the different specialties a little bit more, first we have dental anesthesiology, and like if you think of anesthesiology, think of like numbing a patient. So this is practiced when you have oral surgery, you have like implants, crowns, or even like fillings, that procedures that need to the patient must be numbed. Is not only just managing the pain, but also making the patient feel more comfortable and making sure that their visit is the best visit they can get. Dental public health is more about preventing dental diseases and promoting oral health literacy and like access to healthcare, access to dental care in underserved communities. It's about like the well-being of the public rather than like the well-being of a single patient. Oral maxillofacial surgery is like more commonly known as oral surgery, and it's just like working and with diseases or injuries in the hard and soft tissue of the oral maxillofacial region, which includes the mouth, the face, and the jaw. Oral maxillofacial radiology, think of radiology, think of like x-rays or radiographic images, and like these experts interpret these images and look for anything that might affect the head, neck, face, and jaws. Oral maxillofacial pathology, and the pathology is like the behavior or like the nature of certain diseases that affect the oral maxillofacial regions. This can include like diagnostics, research of these diseases. And then endodontics is also a really common dental specialty. Has to do with the dental pulp. And as you can see on the image on the right, the dental pulp is kind of like the center of the tooth where all like the blood vessels, the tissues, and cells are. And so endodontics usually perform procedures like root canals and dental implants, and they work within the pulp of the tooth.
Okay, so the next 6 specialties are oral. So first of all, it's oral medicine. It's like about the diseases, that medically related diseases about your teeth. And then oral pain, it's like your pain in your teeth and or like pain in your jaw or like your face in general. The next is periodontics. It's just like the diseases of like the surrounding tissues of the teeth. So for example, like your gum or like the implants and stuff. And prosthodontics, it's just like when a patient has like mission teeth or like tissue, then you go to like a prosthodontist to like get checked up. And orthodontics and dental facial orthopedics. But orthodontics, it's like all about braces that everyone is like familiar with. And then orthopedics is about your facial structure, like your bone structure. And the last one is pediatric dentistry, which is like the dentistry that dealing with like all the infants and kids.
Okay, sorry, I was muted. Okay, so I'm just gonna go through, what does being predental mean? So traditionally you have 4 years of and you graduated with a bachelor's degree. In some cases, you can actually attend dental school without having your bachelor's if you've completed all of your prerequisites, but usually you're gonna attend 4 years undergrad and graduate with a bachelor's. You can actually be any major. A lot of people have this misconception that you have to be like a biology major. There's no such thing as a pre-dental major. It's really just a pre-dental curriculum that you follow. So like I said earlier, I'm actually a nutrition major. I'm really happy with my major, and I chose it because, I didn't want to be a standard biology major. I wasn't super interested in just biology. At the end of the day, these are the classes you have to take. So I actually enjoy taking nutrition related classes and found that a lot of the classes for my major overlap with prerequisites for dental school. And I'll talk about the specific classes that you have to take for dental school later in the presentation. You also have to complete, volunteer and shadowing hours. So by the time you apply to dental school, you should have around 100 shadowing hours and 100 volunteer hours to be considered a competitive applicant, if not more. You also have to take the DAT, which is a standardized exam that you would use to apply to dental school. So just like the ACT, SAT, it's the same concept, but the test is different, and we can talk more in detail about that if you guys want during the Q&A. I also think if you're going to be a pre-dental student, you should be not only in it for, everyone wants to say they want to help people, but a lot of people say they want to help people, but you could be a social worker and help people. You could be a doctor. Why dentistry? And I think you should be really passionate about the field, because if you're passionate about your work, it's not really so much work. So I think you should be interested in, oral health, just like education in general. So I think that's kind of all part of the pre-dental experience. So what kind of student is going to be a good fit for pursuing dentistry? I think someone that really enjoys working with their hands, someone that is creative, artistic, because there is kind of an artistic side to dentistry. That's what I think makes it so much different than being a doctor, is that you're not only treating patients' issues, but you're also working hands-on with patients. You should also be willing to commit to 8+ years of education. So you're going to have 4 years of undergrad and then 4 years of dental school. And then if you want, you can choose to specialize if you have the grades for it in dental school. So you're looking between like 8 to like 10, 12, possibly like 12 years of school education, if that is something you want to do and specialize. You should also be friendly, enjoy working with others in a group setting, because you're going to be working not only with patients, but with other dentists. In school, it's very, when you're in dental school, it's not necessarily like every man for himself. There's a lot of collaboration and working with your peers. And you should be very passionate and active in the community. You should always want to learn more in this field because it's changing all the time. So why dentistry? These are some of the personal reasons I chose to pursue dentistry. In high school, I didn't really know exactly what I wanted to do. I knew I wanted to be medical, but I didn't want to be a doctor. So I just knew that there had to be specific reasons why I choose dentistry. So one of the main reasons I chose to pursue dentistry is because the flexibility and independence you have as a dentist. You have the ability to be a practice owner, and you are a practice owner, you are a business owner, you're a businesswoman, a businessman, and you are your own boss, which I really like that aspect, that I'm working for myself and I get to be a leader to other my workers and staff can help like work for me and run a business. So that's what I really liked about that aspect. And then I can choose to work 3-4 days a week if I want. I can choose my hours. You just have that flexibility. And that was also something really important to me as a woman. If I want to have a family in the future, I just felt there was more flexibility. There's also a lot of inspiration because you can see the results of your work right away. Also, sorry, no 2 days are the same. I worked in 2 dental offices during undergrad, and there was no 2 days the same. Every day was a surprise, and I never felt bored working in an office, which is an aspect I really liked. I never want to feel like I'm bored with my work, and I just don't think that's possible when you go into dentistry. How the shape of oral health care, you get to educate your patients. I think that's really an important aspect, is that you are also an educator as much as you are a doctor. And of course, there's job security. Everyone's always going to need a dentist. And then as well as the lifestyle and respect. Yes, a dentist does make good money. Also, there are a lot of loans and debt that you usually have to go into when you pursue dentistry. But you do, with the flexibility and lifestyle and just the work in general, are just kind of the reasons why I chose to pursue dentistry. I didn't choose because I didn't want to commit to 4 years of undergrad, 4 years of medical school, internship, residency. That just I didn't want to work in a hospital setting when there's not really any flexibility. So I'm just going to go quickly through just the pre-dental timeline, what it typically is. So your first year in college, you're your freshman. This year is a really important year because you're trying to really develop study skills and study habits that are going to set you up for success. So it's really important to start your first year of school with a strong GPA, because as you progress through college, it gets harder and harder to raise your GPA, just because you already have your GPA behind you from previous years. So it gets difficult to raise your grades if you need to. So it's really important to just develop study skills. College is something, it's very different than high school because you're now balancing on your own. So I thought that was pretty hard my freshman year. You're gonna join clubs. You should look for work, make new friends, just like kind of network and meet new people. This is kind of a time to explore. You can definitely begin shadowing. I began shadowing this summer after my freshman year. So going into my sophomore year, I was joining clubs. I actually was part of the Predental club and held a leadership position, which was awesome to have my freshman year. It was a great experience. And you're also going to start taking your basic prerequisites. Your sophomore year is pretty much the same. You're going to continue taking those classes you need to take. You're going to continue shadowing and volunteering, and you're going to try to obtain leadership positions. Leadership positions can be anywhere. It doesn't have to be just dental related. I had a leadership position in my sorority that I was in. I had a job my sophomore year. I now hold multiple leadership positions going into my senior year. So I think it's a great opportunity and looks great on your application. A lot of people choose to take their DAT after their sophomore year if you've already taken like biology, general chemistry, and organic chemistry, which most people have. If you can take it after your sophomore year, that's a great idea because those classes are still really fresh in your mind. If you're like me, you might take it your junior year, which is what I did. I just took my DAT beginning of the summer. So I took my DAT junior year. Junior year is a really important year because you have to ask for letters of recommendation. You have to write your personal statement, take the DAT if you haven't, and you have to now begin applying to schools if you plan on attending dental school after you graduate your senior year. And I'll talk about the application process in the next slide. And then your senior year is when you are just finishing any remaining prerequisites, classes you have to take before you graduate, and you're going to start interviewing and hopefully get into dental school in December is when you would hopefully find out. Most of the time is when you find out, December 1st. So that's kind of a year you can chill and all the hard work is done applying and your DAT is done for a typical student. So these are the specific prerequisites. On the left side are classes that pretty much every dental school requires. So you're going to take biology 1 and 2, general chemistry, organic chemistry, English, and pretty much every school, I think physics 1 is required. I don't think every school requires physics 2, but you also just kind of have to check with the school wherever you're applying. And then on my right are classes that not every school requires, but most. So there's not really a math requirement for dental schools. Some require calculus, maybe like 5 schools or so. I didn't take calculus, so I didn't apply to any of the schools that required calculus. If any, some schools might require statistics, which I did take, and I took pre-calculus, but it just really is school dependent. Biochemistry is also required by a lot of schools, but not all. Same with microbio, anatomy and physiology, stuff like that. It's like school dependent, and there are others as well. But if there was like one class to take for one dental school, but I wasn't really required of me for others, I probably wouldn't take that class and not apply to that school. So I'll just talk about how I'm a nutrition major and how my major requirements overlap or don't overlap with dental school requirements. I don't know if most of you guys are either high school students or current college students, but as a nutrition major at Ohio State, a lot of the classes that were required for dental school actually did overlap with my major, but some didn't. So for example, I believe like anatomy wasn't required of my major, but I chose to take it because the Ohio State Dental School required that I take anatomy. So that was like an extra class I had to take, but I just chose to take that anyways. And I'm glad I did because it's a really important class in dental school regardless. So the application process. Every school takes the ADEA Access Common Application. It's just like when you're applying to colleges in high school, you fill out this common application. It opens every year in like mid-May, and you can't submit it until June 1st. So it opens, you can work on it, and then once June 1st rolls around, then you are open to submit your application. This application is where you're going to document all of your experiences, all your shadowing hours, all your volunteer hours. It's literally all of your 4 years of college on one application. It's where you're going to add your scores, your personal statement, your letters of evaluation, all that stuff is going to go there. So your personal statement is something you have to write for dental school. It's pretty much, why did you come to choose dentistry? Why do you think you'll be a good fit in this field? And I have a post on my blog page specifically about this. I have a post about almost all of these topics on my blog if you guys want to look at that more. And I can send a link to my Instagram as well. But yeah, your personal statement is 4,500 characters. And it's just going to be like about you pretty much. Then you are going to add your recommendation letters. So my suggestion for recommendation letters is that if there's a professor maybe you wanted to ask that you took maybe your freshman year or sophomore year, you can still ask that professor and email them and let them know like, hey, I used to be in your class. You can ask them when you take the class and say, I'm going to be applying to dental school next year in 2 years, but I want you to write me a letter, and they can hold on to it for you, or you can store it in Interfolio, which is a website that you can use to store letters. You have to pay for it though. You can have maximum of 4 recommendation letters on your application. Every dental school kind of has their own requirements for recommendation letters. Not every school is going to go, I want 2 science, a dentist, and whatever. Some might only want 2 letters, some might want 3, some might want all 4, some might want 1 dentist, someone might 2 science. It just depends. So you kind of have to check with every dental school that you're applying to and make sure that the letters that you have will fulfill their requirements. So I believe I had my molecular genetics professor wrote me one, my general chemistry professor wrote me one, my dentist, and then my research professor, because I did research this previous year, she wrote me a letter. So I had 4 letters. You'll also add your unofficial and official DAT scores to your application. And then there's only 8 schools that require the Casper test. It's something you do after you apply, and it's basically just like an ethical assessment. I have a list on my Instagram of what schools specifically require that. I think it's like $25 to take this test, but only 8 schools require the Casper test. So if any of you guys are in high school, I'm not really sure who our attendees are, but if you guys are in high school and you're considering a STEM field, but don't know exactly what you want to do, I highly suggest that you guys shadow. I shadowed multiple different careers. I shadowed a speech pathologist, a nurse practitioner, a physician's assistant, because I was really convinced I wanted to work in a hospital. I thought it was going to be like Grey's Anatomy and like so fun. I was honestly so bored, and it's not like the shows. And I was like, this is not for me at all. So I'm really glad that I had that experience and got to shadow different professions. And I also got to shadow dentists in high school and college and made sure that this was really the field I wanted to go into. So I think it's totally normal to change your mind about careers if you don't know what you want to do. But I think it's super important to shadow and make sure it is what you want to do. So we're going to do a Q&A, I guess, and we have about half an hour. So if you guys have any questions, you can send them in the chat, and I guess you can unmute yourselves if you want. And I'll look out for questions. Okay, sorry, I'm just gonna take a sip of water. Okay, so someone asked, how did I finish college a semester early? So while I was in high school, I live in Ohio, I'm from Cleveland. So I don't know if every school offers this, but I took college credit plus classes. I don't know if this is like just a state thing, if it's just an Ohio thing, but I basically got to take college classes in high school. So some of the classes I got out of the way was my like English 1 and 2. Instead of taking English in high school, I took them through a university like online, and it counted as my high school and college credit. So I got like some basic classes out of the way. I also took a lot of summer courses. Like I took my organic chemistry 2 class over the summer because I didn't want to take it during the semester. I also had a pretty hefty schedule my freshman year. I think I took a lot of classes, not knowing what I was doing. I think I took like 18 credits one semester. I don't recommend that. I took a lot of classes. I was basically just ahead. And when I transferred, I did not get credits for like some of my classes. So I probably could have graduated a whole year early, but it's fine. I enjoy college. So I was able to graduate early because of that. For shadowing, do we ask the dentist to verify your hours? So basically all of your shadowing and volunteer hours are like the honor system. So what I suggest you guys do, and something I wish that I did when I first started shadowing and volunteering, is keep track of everything in an Excel sheet or Google sheet. And I have a template for this also on my Instagram, the link in my bio. I have a lot of I have a Google folder full of like templates and stuff that you guys have access to in DAT notes. And you should keep track of the date you volunteered, and just kind of like your overall experience, maybe volunteering and where, because on the application for dental school, you're going to be able to write like a short little, I think it's 600 characters you have to just write about your experience or whatever, describe what you did. So it's really important if you just keep track of it now, and you can just copy and paste when your application comes around, make it so much easier for you. So everything's based off of the honors system. What work did you do your sophomore year? I actually worked my freshman year and sophomore year. So my freshman year, I worked at my school's like diversity and inclusion office, and I just worked as a front desk assistant. It was nice. I literally just sat there and like did homework and got paid for it. And then my sophomore year, I worked at the Ohio State Dental School as an office assistant. I pretty much managed like patient charts and files, and I just kind of did whatever they needed me to do like behind the desk. And then I did research my junior year. I did research the fall and spring semesters. Okay, so someone asked if you completed AP classes in high school. Yeah, so I also did actually complete AP classes in high school. I forgot that I did that. So I got like my psychology credit out of the way. Yeah, so whatever college you attend, if they accepted your AP credits and you were credited for that, then so will dental school. So if it's on your transcript for your college, when you apply to dental school, you add all of your transcripts from every college you ever attended. If you transferred schools, if you took a summer class, if you took a class at just one class at a different school, every class you took at any institution, you will add to your application. So you will absolutely get credit for AP classes if your university gave you credit for them. How did I land an office job at the dental school? At Ohio State, there's a student like job board, and you can just go on there, and I don't know if every school has this, but we have a student job board, and there's just jobs posted, and I just applied for a job in the dental school. It wasn't like glamorous or anything. I was hoping I could like get my foot in the door and like meet people, but I pretty much just like was behind a desk all day, and it was like not that fun, but it was still a great experience. I just reached out and I did an interview. So as an international student, how can I stand out among all of the applicants? This is a great question. Obviously, I don't have much experience as an international student. I think it's really important, to still get your volunteer and shadowing hours. I don't know where you're an international student from. I don't know if I'm the best person to answer this question because I just don't have this experience, but I think you should still have your volunteer and shadowing hours for sure. I don't know exactly how those transfer over, if they still accept that, if you could do those in the US. Maybe if you shoot me a message on my Instagram, I can like think of something, I can message you on there because I'm not sure right on the spot. How did I get started in research? I got started in research because so my major at Ohio State actually requires that I do like an internship. But because I'm pre-dental, there's not really like internships for dentistry. So if I was really a nutrition major, I could have worked somewhere, done something for nutrition, but that wasn't really going to help me like further pursue my career and endeavors. So I got credit the first semester that I did research, and I just emailed every professor at Ohio State that does research and asks, like, are you accepting any students? And this was during COVID. I had no one got back to me, and I totally got a position like last minute for research. I just messaged anyone, asked if they were taking students. I didn't even care who I was doing research with. I just needed to get the credit regardless, but I still continued, even after I did the credit, I continued to do research my spring semester with the same professor. Okay. Doesn't look like there's any more questions. But if you guys have any questions later that you think of or anything, just message me on my Instagram. I'll put the name of it in the chat. Yeah, so on my Instagram, I have videos. I have in the link in my bio, I have access to like all the study notes I used for the DAT. I have a video of my DAT breakdown. I'm probably gonna post a content tomorrow. I have a lot of stuff on there. What are your tips, study tips for undergrad? Great question. So I think study tips, I think study habits are something you really have to develop your freshman year because you kind of just like don't know how to study yet. And I felt the same way studying for the DAT. I was like, what is the best way to prepare for the DAT? Because there's so much information, it's very overwhelming. And if you're going to be a freshman, I'm sure you probably don't even know what I'm talking about yet, but it's kind of something you have to figure out. And as you take more classes, you'll just see how your professors are, you'll see how tests are structured. Like it's very scary at first. I felt like I'm really someone that has to write out all my notes. So you're kind of slow at first, you're figuring out what's best for you. I would go to like the library and I would handwrite everything on a whiteboard because I was like, I can only memorize it if I write it on a whiteboard or if I write it out in my notebook. It just kind of depends. You have to really put in the hours, prioritize school, and it'll just come to you the best way to study. And if you realize and you notice that your grades are not doing so hot, then you need to reevaluate how you're studying. And if you do not so well on a test, you need to reevaluate, how did I study for that test? I need to change what I'm doing. And everyone has bad tests. Everyone has a hard class. Don't think, you figured it out right away, but it's just kind of something you'll figure out as you progress through school. Okay. All right, now I really don't see more questions. Okay, one more question. Organic chemistry. So someone said okay, these are public, everyone can see these. Stress for organic chemistry. Organic chemistry is probably like one of the hardest classes I took in undergrad. I spent a lot of time on this class. This class was actually my life. I was doing organic chemistry all day, every day. I was in office hours all the time. I don't know if your university or professor or your TAs offer office hours, but you should take advantage of every free resource your class offers, because I was literally attending, my class had 600 students in it. There was 2 lectures. There was 600 students. And sometimes I was the only person to show up to office hours out of 600 people, like literally the only person. And it would just be me and the TA. And I would literally have the TA to myself. And even if I didn't have a question on a topic, I'd be like, can you just review my homework for me? Like make sure this is right. So I never like was missing stupid points, silly points. You have to like try to get your points everywhere you can get, because even on the exams, I would get like, the class is slightly curved a little bit, I think. It just depends. I don't know. My semester was like a whole mess, but it's really important to just put in the work, because that class is just really time consuming. Now that I just studied and took the DAT was like so simple compared to my organic chemistry class in undergrad. Like it was literally so easy, but I prepared so well in undergrad that it felt easy on my actual exam. And honestly, the concepts are like not that difficult once you get them. It's like, of course they make the class a lot harder than they is, because it's like they're weeding people out. So I think just put the time into the class and just review, and like hopefully it just clicks for you. Advice not to do. Oh, by the way, here's all of our student information. Common mistakes students make. Well, I have like a lot of people miss classes that they have to take. They don't realize that they had to take a certain class and now they can't apply to dental school or they can't graduate. I think you should make a like 4-year plan when you start school. Plan out all the classes you're going to take. Some classes are only offered certain semesters. So like if you need to take microbiome and it's only offered in the spring, but you already have these other classes in the spring, it just depends. So I think you should meet with an advisor, make like a 4-year plan, know exactly what classes you're going to take when they're offered, and so that you don't miss anything and you can graduate on time and still apply to dental school on time. Okay. Any more questions? And if you guys, you can also unmute yourselves if you want and ask a question. But right now, I don't see any more. But again, please message me on my Instagram if you guys have any questions. You can also message like Youth in Dentistry. If you have questions, like if you want to work for Youth in Dentistry as like a volunteering. But if you have any general questions, please message me anytime. That's what I'm here for. And thank you guys all for joining this webinar. I hope it was helpful. I hope I didn't talk too fast. Let's see any more shots. Okay, awesome. Thank you guys so much. I'll stick around for a few more minutes if anyone has questions, but thank you guys.
Hey, I do have one more question, excuse me.
Yeah, sure.
So I'm taking OChem right now, and I passed the first one with the C+, and for the second one, I might fail it. I just want to ask, what if I fail it? What should I do? Because I'm planning to take a DAT during the winter, and if I fail, should I wait until I finish OChem 2, or should I just take the DAT and retake the class in next summer?
So are you planning to apply the next cycle? Like, are you going to apply this upcoming summer?
Yes, basically next year. Yes.
Okay. Well, honestly, when I was taking, it might make it very difficult for you studying for the DAT, considering you got a C+ in OChem 1. Because although the DAT is like a lot more simpler, there's like a lot of reactions and mechanisms you need to know. Like you really need to know the basics very well, because the basics are like really what's like what the questions are on. I don't think you necessarily need to take the DAT in the winter. Why were you going to do it in the winter?
Because I have to do it. Sorry.
What?
Oh, I said
Sorry, over winter break, you were going to take it?
because during the winter, I have 1 month free, and also for the summer, I'm going to prepare for the personal statement and everything else to apply.
Okay. My suggestion, if you end up having to retake organic chemistry too, if you have to, hopefully you don't have to, but if you do, my suggestion is that you could retake that in the fall if you need to. And then I actually took my DAT the same summer that I applied. So I don't know when your school like spring semester ends, but I took my DAT. I started studying for it in May. So I studied like 70 days, May, June, and then I took my exam mid-July. And I already had my application submitted before I took my DAT, and I just added my score afterwards. And I had everything done by August. So I was still like early in the application season, and I still gave myself like over 2 months to prepare. So you could still, and I had my personal statement, everything done before I took my DAT. I did that, like I wrote it like during the spring. So you don't necessarily have to take the DAT over winter break if that's what you want to do, because I don't think 1 month is enough to prepare regardless. You would have to overlap with school, and I really didn't want to overlap with school. So that's why I waited till literally my spring semester ended, and like that next day I started studying for the DAT because I didn't want to have to take classes at the same time. The DAT was like extremely overwhelming for me at first. I have a video on my Instagram, like my whole experience, and I also posted a breakdown of my scores and stuff on Facebook, and I can message you those details too. But my suggestion is maybe don't take it over winter break, because I don't think it's like best to have to overlap your studying with schoolwork.
One thing I'm wanna like consider into is what if I have to retake it again? For example, I messed up with the first DAT and I can give myself a second chance to take it in the summer.
Yeah, so that is the thing, but you have to wait 90 days between DAT retakes. Hopefully you don't have to retake it, but I understand you're saying you always want to have that like security. If you had to retake it, do you know when your semester ends, your spring semester? Like if it ends in May or if it ends in June? It's okay if you don't.
In May, yes, in May.
Okay, my semester ended early May. I started studying May, June. You could give yourself like 3 months or something to study. Like you could take longer than I did. I had about like 10 weeks or so to study. No, that's 100 days. What am I saying? Like 7 weeks. I don't know. I had like a little over 2 months. You could take the DAT after in like October, September, October. That would be considered more late. Hopefully you don't have to retake it, but I understand what you're saying. Take it. This is the hard thing because if you're not consistent with studying and think that you want to study, like I was like, let me just start reviewing a little bit in the spring. If you're not consistent, it's not going to work. Like I really needed no distractions. I only studied for the DAT. I couldn't do schoolwork at the same time. People do it. I think it's extremely difficult. Maybe you'll need more time for it, but if you think that's what you want to do, you can try studying for it. Also, if you take the DAT once and you decide you want to do it again, you're probably going to have to pay another $500 for the test. And then also pay for another like booster subscription or boot camp subscription. I used booster, which I highly recommend, but I personally suggest taking the DAT in the spring, and hopefully you don't need to retake the DAT, but I understand if you want that security, you could still retake it. And you would just have to add your scores afterwards and let schools know that you plan on retaking the DAT. But I don't know, honestly, I felt the DAT was, it's more about how you study than what the content is really not that hard. It's very surface level, but it's just a lot of content at once.
Okay. So 1 month is definitely not enough to prepare.
You say only one, taking organic chemistry one?
Yes, but I'm saying like, I only have 1 month.
Oh, yeah, no, 1 month. For me, are there people that do it? Yes, I don't know how they do it. I really don't think 1 month is enough to prepare because I personally took 1 month just to review content, just to go through the stuff. There's like when you go on Booster or boot camp, I suggest using Booster. It's what I use. They have like a study guide for you, like what to do every single day. And the first month on there is solely just watching videos and like reviewing and learning content. The second half is like just doing practice tests, and that's when you learn the most. Is when you take practice tests and review them. And it's really time consuming, but that's really when you actually learn material. So I don't think 1 month is enough, and I would minimum take 2 months, personally. You're welcome. If anyone else has questions, if not, then we're good.
Thank you so much, panelists, and thanks everyone for listening. Take care. Thank you, everyone.
Thank you.
Yeah, thank you.